Era uno degli studi più attesi qui ad Amsterdam in occasione del congresso europeo di cardiologia, l'ESC. Stiamo parlando dello studio Hokusai che ha confrontato l'efficacia e la sicurezza dell'Edoxaban, un nuovo anticoagulante orale, nei confronti del warfarin, in pazienti con tromboembolismo venoso. Ci siamo fatti raccontare come è andato lo studio dal professor Büller dell'Università di Amsterdam, primo autore dello studio.
Could you please describe briefly the protocol of the Hokusai VTE study?
Hokusai VTE compared low molecular weight heparin followed by Edoxaban 60 mg once a day, fixed dose, with low molecular weight heparin followed by vitamin K antagonist. And what we're trying to do there is get all patients with deep vein thrombosis, pulmonary embolism, both.
There are some features of the study which make it describe it as a real-life study. Could you please tell us which are?
Yes, I think real life is by leaving the heparin in. We have the impression that colleagues were happy to really put in all patients, and I think the evidence is that in particular the more severe DVT and the more severe PE were also entered into this study. And therefore, because the study is so large, 8,292 patients, the subgroup with big clots is actually so large that we can even derive conclusions there.
Also, the length of treatment is something different from the past.
Yeah, so we followed all patients for 12 months. Some stopped at 3 months, some stopped at 6 months, some went on to 12 months. And this is, I think, the beauty of the study. We will be able to analyze all those different groups. At the present time, it is very clear non-inferiority, so it's as efficacious, less bleeding, 20% less bleeding, and of course, much easier to use.
The efficacy is good on the whole population, but it seems to be better in the most severe patient.
In the most severe patient, we were really surprised. We had hoped to get these patients in, and we're very, very pleased to see that they are there. But it's in that group where the regimen of low molecular weight heparin followed by Edoxaban did much better. Actually was statistically significant, but also clinically relevant, better than the standard treatment. And I think that's one of the big lessons, that these new agents also have something to offer in that subgroup of patients. Not to all, of course also to all patients, but also in the more severe patients.
And the drug performed well also in the safety part of the study?
Yeah, the safety, mainly the bleeding. There were no other unwanted side effects. The only side effect is bleeding, but that was 20% less than with the standard therapy. So you get something that works as well, it's safer, and easier to use.
It did very good also in the intracranial bleedings, correct?
Yeah, this is a pattern we've seen with many of the new anticoagulants, really less intracranial and less retroperitoneal bleeding. Very important, because those are devastating bleeds.
Final comment, Professor Büller?
I think now we have 4 phase 3 trials, and our colleagues around the world can make up which one they want to use. Beautiful studies, good results.